Thank you, Raquel. Hi, everybody. My name is Megan. Really grateful to be here with you all today and grateful for the work that you all do. So Raquel and her story, albeit the shortened version, really provides the inspiration and the experience that is the bedrock of Operation Care. And so when I came on to Hard Beauty just about a year ago, Operation Care was an idea, a very raw idea at that. We had a logo, we had a name, we knew who we wanted to serve, where we wanted to serve, and in essence, how we wanted to show up, yet we needed the actual program. We needed the workflows behind that. We needed the process behind that. And so I oftentimes share that it's been very similar to driving a road at night where you only have your high beams on and you can only see what's in front of you. And so as we've been moving forward, it's become more and more clear as to the work that we do and how we're going to show up. And so I'm excited to share with you today what we do have. We have a lot more form a year forward. So Operation Care stands for Compassionate Acute Responsive Engagement. So we are designed to meet the high acuity needs of those who are facing layered challenges related to substance use disorder. And I'd like to say layered challenges because we know that substance use disorder is not one-dimensional. Oftentimes that comes with varied trauma. It comes with mental health diagnoses. It can come with intimate partner violence. All of those many things our coaches are equipped to meet and to support. Going on to say that we provide immediate support services. So our care coaches respond to referrals in a variety of medical settings, including emergency departments, clinics, labor and delivery units on a same day or next day basis. And so I just want to also highlight immediate. So really what Operation Care is, we provide gap services, right? And so if we are working with, a facility, mom baby unit, and the caseworker there and mom needs support, we can't say to them, okay, well, if you could just have mom visit our website, fill out this pretty lengthy application process, and then wait 24 to 48 hours until our clinician can reach out and we can complete a biopsychosocial. That's just not enough, right? And so with what we've designed behind Operation Care, instead of it being client initiated, it is provider initiated. And so we've really tried to streamline that process as quickly as possible, understanding how busy you all are. And so we really just ask for the bare bones in terms of what is actually on that referral form. We want to know where mom's at, how immediate she needs help, and what are some of those, the contextual circumstances around the need for help. I often joke, and one of our case managers that we work with quite often at Swedish, she will say, I'm clicking out of the referral, and as soon as I'm clicking out, I'm getting a phone call from Operation Care. So we really like to pride ourselves on being responsive and being immediate. And so I think probably some of the immediacy and the celerity of our response time is we have had a coach respond within an hour. So of getting that initial phone call. So as oftentimes we know, mom is often there with herself. She has no support. And so for us to be able to provide a coach within an hour of that referral coming in is absolutely huge. So our care coaches offer non-clinical support. We use a strengths-based model and we meet people where they're at. And I recognize that that has become quite the catchphrase. And what does that mean for us? We meet mom where she's at in terms of her readiness and in terms of her willingness. And I'll go on to talk a little bit more about what that looks like. So I really, and for this slide, like to highlight the R in Operation Care, which is responsive. So we're responsive not only to the moms that we serve, the clients that we serve, not only to the facilities in which we serve and our coaches as well. When we initially started this program, we were really just looking at serving bedside, right? And as we were meeting with more and more hospitals, facilities, providers, we were recognizing that there really is a need to be able to support the clinic as well. And so those have become really our two service lines under the umbrella of Operation Care. So we refer to inpatient referrals as bedside referrals. So those are generally going to be moderate to high acuity. Oftentimes mom is an AMA risk. Oftentimes CPS is involved. Like I mentioned earlier, there's little to no communal or familial support. And so it's incredibly important for us to be able to get a coach there as quickly as possible because we want mom to be able to stay and we want her to know that she does have somebody who's been through similar circumstances who cares. And then those particular referrals are usually usually generated from mom baby units and postpartum units. The service line that we were able to carve out as response to what you all were talking about and needing is the clinic referrals. And so those are generally of lower acuity. Prenatal, we consider those to be more interventional in nature. And there is, an opportunity under that service line for mom to be able to work with her coach for a longer period of time. So there's a lot more skill and there's a lot more goal building that we're able to do under that service line. So our pillars of service, so inspired by Maslow's hierarchy of needs, that bedrock pillar is really going to be the emotional support. So our coach being able to show up with the lived experience of substance use disorder, of recovery, oftentimes of having CPS involved, having their kiddos taken away, getting their kiddos back, really just being able to be somebody with mom in that sterile, scary hospital room who's of mind, body, and spirit. Offering that empathy, planting those seeds of change, and providing that hope. Next, we want to know what mom needs in that immediate moment, right? Does she need a nightgown? Does she need slippers? Does she need something that can help provide warmth and comfort in that sterile setting? Does she need assistance with getting a phone? Maybe sometimes she just needs a phone charger in that moment to be able to connect with her coach or any outside family or support. Once we feel as though mom has what she needs in that moment, then we can really start to build upon that relationship and get more of a clear understanding as to how we can set mom up for success for once she discharges and how we might be able to bridge her with outside entities and outside resources. So I love this quote right at the top of the corner, and it says that change becomes more probable when basic needs are met. So we cannot anticipate mom to initiate or sustain any changes towards recovery if she does not have those most basic needs. So that's really what our care coaches get to do. They have a passion for that. They have a lot of really formidable ties within the community in terms of resources and partnerships and collaborations. And so our coaches really take the time to get to know mom's unique journey and understanding what she needs, what her relationships look like, what housing looks like, what safety in the home looks like. Does she have access to technology? Does she have access to Wi-Fi? Does she need an email address? We can help with those very basic things. I know Raquel has some props here. So one thing that we have done to ensure mom's comfort in that moment is we've provided something called care bags. And so they're pretty basic, but they go such a long way in that moment. Like I said, some socks, and we have our little hard beauty onesies as well. So really just taking the time and the thoughtfulness to be able to show that love for her and show her that she's cared for.
Care bag, so great. It has some great essentials in it. So when we were writing this, and we were writing mom had nothing. Care bag, go out to everyone. The cups are actually made by another mom in recovery, so we try to really keep everything going around the circle, right? And so Jamie, if you've all met Jamie, she's one of our coaches. She also does printing, and so she's made these wonderful affirmation cups that has positive affirmations. I have everything I need within myself. I have much to celebrate about myself in my life, so we start that off, and everyone we respond to gets a care.
I mean, even something so simple as a hairbrush, I mean, I know the hospital has, those flimsy little combs that they can give out, but that really doesn't help, right? So just providing that extra care and attention. So impact by the numbers. This program, as you can imagine, the need and the demand has been almost more than we can catch up with in that moment. And so we are continually, really refining our process and developing different tools so that we can capture this data. So impact by the numbers is we currently work with 12 facilities across Colorado. So from Denver metro area to the Eastern Plains to the Western Slope, we work with clinics down in Pueblo, Grand Junction. We work with Denver Health. We work with Children's Hospital. So we're continually, bringing more and more facilities into the fold of the services that we provide. Our coaches have been a part of 36 births. We have 3 babies on the way, and we actually just had our first set of twins, which is really exciting. Our team has been a part of 21 interceptions, and I'll let Raquel share a little bit about what we define as an interception.
Yeah, an interception. Oh, absolutely, yeah.
Oh, yeah.
So we consider an interception, there was a play on the field to have a baby taken from a mom. So we throw an interception on the play, and we have intercepted 21 children from going into a system. Whether that means we intercept and say, hey, mom, is it time for you for treatment? How about we get grandma to take baby? But we have been able to prevent 21 cases. That is a huge number considering what we're all combating. And then, like I always like to say too, those are some of the most successful. We have a beautiful little chat that we get to be a part of where we get to see babies coming into the world. And the other part on that is that of our coaches too, we have 6 of us are doula certified. So we actually can come out, not only, especially at Denver Health, if we have someone who's unhoused, 6 of us, including myself, can help birth that baby, and also do advocacy work. I've done that several times, even myself. And so that's where it's really powerful, especially if a mom comes in and has no familial support, which many of our moms do and have nobody around. But that interception has been wonderful to see that number increase. And we just started this. My first call I responded to was the day after Thanksgiving last year. So this is in less than a year, what we've been able to do with very little formation. Can you imagine what we'll do a year from now? Yeah. Especially we're doing plans of safe care implementation in the Alamosa region with Illuminate. So I just can't wait to see how much more we get to do across the state, especially that interception number. That's huge for us.
So we currently have 64 active Operation Care clients. Now I will let you know that pregnant and birthing people are not the only population that we serve. We're also starting to do some work along the Eastern Plains with rural communities as well. So the 64 number does include that population as well, as does the estimated total of those we have worked with since inception, which is just roughly over a year ago, which is at about 138. So just by the just by the numbers alone, you can really see the breadth of the work that our coaches have been able to do in such a short period of time. Taking care of those who take care. So Operation Care is not just for mom, right? It's not just for the client that we serve. It's really for the entire system, the entire familial system. So we are in a position where we're able to support dad or partner or any other family members who also are interested in seeking help and change and growth of some sort. But we're also taking care of those who take care of you all and the facilities that we serve. So right here is a quote from one of the facilities that we serve, a case manager there. She says, "The support is a huge benefit for our patients. The coaches are able to meet patients during their most challenging time and help support them in navigating whatever might be next." And that's just one more example of meeting clients where they're at, because what's going to be next for one person is not going to be next for all people. I've had peer coaches help to de-escalate patients so that they remained in the hospital instead of leaving AMA. That's huge. That's huge. I have had coaches be supports for the family members and the staff. It is a layer of care and support that we cannot provide to our patients. Also, the only times I have seen patients be successful in getting into substance treatment immediately from the hospital was when our coaches are involved. So we work considerably with New Directions. We also work with the Aspen Center, and then also Reflections. So that just goes to show, I think the solid relationships that our coaches have with participating community members, that we are able to get mom from discharge at Denver Health immediately into care. No stops, as I like to say. And so here's some of I don't think our slides transferred over too well, but here are some of our coaches. And so I really love to highlight our coaches as well, because the healing is so much more and so much beyond, again, just those that we serve. This is really what I like to call integration for our coaches, because this is oftentimes full circle moments. As I mentioned, our coaches are coming bedside with a wealth of experience and lived experience. And so by them getting to work with mom and getting to have immediate placement for mom and getting to be a part of those interceptions, it really just is such an integrating experience for them as well. So on the left, we have one of our coaches, Jessica. She says, "Being a part of this work is 100% God working in my life. I truly do not think I could put into words how much love I have for this work." We actually just got a text before we were coming down here, and she was working most recently at a facility where she ran into a lot of challenge. This particular nurse and some of the other other staff members on the unit were using very stigmatizing language towards mom and very much were hyper-focused on baby, understandably so, right? But mom was by herself and mom needed some support as well. And go ahead and share the quote.
On the same page with that. So yeah, she wrote this morning, she said, just thought I would let everyone know that my client got to bring her baby to New Directions full-time per the judge's recommendations. And so what we're hearing too is that I got to take my baby home only because I was working with Heart Beauty. I got stopped in a park. I was in doing a recovery rally in downtown Denver and I got stopped. And I love to brag about Jessica, this woman comes up to me and says, I just have to tell you, the women that you hire are saving me. They saved me, they're saving my baby. And the only reason I get custody is because the judge finds out that I'm working with Heart Beauty as a coach. That's huge for us, that now judges, right? Because the judge, and hats off to New Directions, because we do a lot of work with them. It's just, we had a high five today I got to with Monica of just, Jessica is one of New Directions. I met Jessica at New Directions, and now she's working full time for us and is fully involved in her kid's life. And she has never been able to be a part of her children's life. And now she gets to, so it's really pretty amazing work. I know, Monica, I'll cry too.
Definitely. And Jessica was actually one of the coaches who, within 1 hour of the referral coming in, was dispatched from Littleton to Boulder County. So again, just really wanting to highlight the amazing work and commitment and dedication of our coaches. On the right is one of our coaches, Jamie, and she says, I cannot explain without tears in my eyes the amount of joy, love, and grace this has given me. My kids get to see a mom who is happy and has purpose and is changing lives daily. Jamie is also spearheading another one of Heart Beauty's endeavors, which is called Mama Recovers. And so she does a lot of stigma and bias training. Perhaps some of you have met her during one of those trainings. She's also working really hard to develop a maternal peer support position. State of Colorado, we're tasking ourselves, but we've created our own workforce as a maternal peer support specialist, and we're tasked with this. We're working with the Colorado CDPHE, and then I'm also working at the national level with the CDC and with Faces and Voices of Recovery on a national project to create this. We also think it will help when it comes to implementing plans of safe care, that these maternal peer support specialists have this credentialing. We created it out of necessity, right? We actually just showed up to do the work. There is no map for us to follow, and I ain't got time for them to create one. So we're just going to show up and we're going to tell you the map that we traveled. So that's kind of our approach to things, and it's working. Yes, so we've seen the impact by the numbers. We have heard from the case managers, we've heard from the coaches, but now we're hearing from mom, and this is for whom the program has been built. And so this quote is from Michelle Lewis, who gave us permission. And I, was meeting with Raquel earlier. I was, why does that name sound so familiar? Well, we just welcome Michelle as part of our team. So she's now a coach. And so we're going to get her through Heart Beauty training and get her some coaches under Heart Beauty. And then the ultimate goal is to bring her into the Operation Care space. So Michelle says, Operation Care played a pivotal role in my current circumstances by welcoming my firstborn into this world. And I just want to highlight here that Michelle did have 4 years in active recovery at the point a coach was able to meet her. And you might be asking yourself, well, I thought this was for moms who are dealing with active substance use disorder. Yes, and not always. We want Michelle to stay in active and sustained recovery. And so that's why we want to be able to provide her with immediate peer support. She'll go on to say that she didn't necessarily think that she needed that support, right? She was also in a facility where she was met with quite a bit of prejudice and quite a bit of stigma. And so she goes on to say that it has made an impact on the entire trajectory of both her and her son's future. I will definitely say so, being that she's now a part of our team. And she goes on to say that with the support, coaching, resources, and experience, that she's been greatly impacted. So with that, that is our presentation. We're incredibly
I want to say one thing about Michelle. She was 4 years in recovery and walked in the hospital on MAT. And the first thing they were going to do was have her pee in a cup. Her mother actually was worried about her giving birth. She lives in my small town. Her mother lives in my small community. I actually come from the town of Palmer Lake, Colorado, so I have a population about 2,600 in my community. We've grown. We were at 22. But her mom was concerned about her and said, I really, really want you to reach out to Raquel before you go have this baby. Please, 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 please. Her mom had an inclination that she was probably going to be stigmatized. 4 years in recovery, on MAT, walking into a very high-end hospital. First thing they wanted her to do was pee, and we're going to involve CPS. And I told her, don't. And I drove my butt all the way from Palmer Lake to Denver to walk in on that hospital for it not to happen. She was lucky because she had two people. She had myself, and I pulled another doula in where I could do the advocacy work and making sure that staff was going to congratulate her. Her first approach in that hospital should have been congratulations for doing what you needed to do for your recovery. She should have been welcomed in. We should have been clapping her in, and that was not her experience. It was her first baby. She did not have a father present. She didn't have a partner. She was scared to death. And all she kept saying for 24 hours, they're going to take my baby. They're going to take my baby. And if you're a mom, you don't have to be someone with substance use to know that the fear if someone comes to snatch your baby. So she can't sleep at night, and so I do think it's amazing. And and I'll never forget her saying, why is this happening to me? Over and over again, why is this happening to me? This has to be for a greater purpose, and in that moment I said, I don't know, but I will walk you through this. And she left her career, that what she was doing before. She managed apartment complexes and worked as an esthetician. And now she has been through coach training. She went through the coach training before she actually had the baby. You want to talk about something in the world that was working for her. She went to coach training before she had her child. And now she comes on full time with us. And she has a DOC background also. She'll be able to go inside. She just got cleared today. I haven't got to tell her yet. She'll be excited to go into Denver Women's Correctional Facility where we get to do work inside there as well. But just an example of how it's not just about someone who's struggling with substance use today. It's about stigma still happens for women who are walking in with MAT who have been on it for years and are showing no signs. She had no signs that she was abusing or misusing substances, yet still that was the first response. So I can't wait for her. Next year, you'll get to hear her talk about her story. So thank you, you guys.